But then there's something else that also matters, and that's the promises that we've made to one another that we haven't put money aside to pay for. And the total of those entitlement promises comes to about $62 trillion. The big ones are Medicaid, Medicare, and Social Security. That money's been spent. The money you've put in over the years was grabbed by Congress and spent. And so how are we going to pay for that? For those that are retired or near retirement, we're fine. We can care for those. But for young people coming along in their 20s and 30s and 40s and early 50s, we got to make sure we're telling people the truth. And this week was a big week because a Republican congressman and a Democrat senator came together and said, we got an idea for making Medicare work. Now, I'm kind of proud because it was the same idea I put forward about a month ago. And so I'm pretty excited about it. And the fact that a Democrat and Republican came together and proposed it is good news. It means that there's a willingness on both sides of the aisle to deal with a tough problem. The idea was this. With regards to Medicare in the future, I'll call it Medicare version 2.0 for young people coming along. For Medicare in the future, you'll be able to get a premium support payment as a retiree, and you can use that to either buy traditional Medicare or to buy a private plan. And they'll compete, the private plans with the government Medicare. And by the way, people of higher income will get a smaller payment. They'll get a smaller subsidy or premium support payment. People of lower income, they'll get a higher payment. And if you do those things, we can make Medicare sustainable forever and get rid of that huge overhang of overpromise. On the Social Security side, very similarly, we can bring down the rate of growth in the Social Security payments for high-income recipients of the future. Now, again, no change for people already retired or near retirement. But that means that for someone in their 20s, they know that if they're going to make a lot of money during their life, their Social Security payment's going to be less than for someone who lives through their life with more modest means. Again, those kinds of changes allow us to keep those programs solvent and protect them and provide them for the next generations. And finally, Medicaid. You wonder what Medicaid is, those that are not into all this government stuff. I have to admit, I didn't know all the differences between these things before I got into government, and then I got into it and understood that Medicaid is the health care program for the poor, by and large. And that's a program that grows very, very fast. The federal government picks up half the bill. The state picks up the other half. And what I would do is have the federal government take its money and give it back to Iowa and say, Iowa, you craft your own program in the way you think best to take care of your own poor. We're not going to have the federal government tell you how to care for your own people. Because, by the way, there are differences between being poor in Mississippi or Michigan or Massachusetts or Montana or Iowa or Ohio. And so let states craft their own programs and then grow that program at inflation plus 1%. If we do that, by the way, we save about $100 billion a year by the fourth year I'd be in office. So I get those programs to work by making relatively modest changes. And you might think, how are you going to get those through Congress? Well, good news, we got Democrats and Republicans seeing eye to eye on this right now. And number two, we need to have a leader.